Writing variant equals standard. Title, Urgent and Emergent Urology Care in NYC. ID, in New York City, where medical resources are vast but demand is constant, urgent and emergent urology care plays a critical role in protecting patients from complications that can escalate quickly. Conditions like acute urinary retention, an enlarged prostate or benign prostatic hyperplasia, BPH, and blood in the urine are among the most common reasons men and women seek immediate attention at emergency departments and specialized urology clinics. While some symptoms can seem manageable at first, urologists caution that delaying care may lead to irreversible damage. Urinary retention is one of the most urgent situations requiring prompt urological intervention. It occurs when the bladder cannot empty completely, or in severe cases, cannot empty at all. The sudden onset of retention is often painful, leaving the patient with a constant urge to urinate, but no ability to pass urine. In a busy city like New York, emergency rooms frequently see patients presenting with distended bladders and severe discomfort. Urologists note that the causes range from prostate enlargement and strictures to neurological problems or medications that interfere with bladder function. Immediate relief often comes in the form of catheterization, where a tube is inserted into the bladder to drain urine and prevent kidney damage. Beyond temporary relief, further evaluation is needed to determine whether prostate obstruction, urethral narrowing, or another issue is at fault. Without timely care, retention can lead to urinary tract infections, bladder damage, and even long-term kidney problems. An enlarged prostate, most commonly due to benign prostatic hyperplasia, is another leading reason men in New York seek urgent care. BPH affects roughly half of men in their 50s and up to 90% of men over 80. While not cancerous, the condition can significantly interfere with quality of life and, in some cases, escalate into emergencies. The enlarged prostate presses against the urethra, making urination slow, difficult, or incomplete. Men may notice a weak stream, hesitancy, or the need to strain. Over time, if left untreated, BPH can lead to acute urinary retention, repeated infections, bladder stones, and kidney damage. In urgent care or emergency settings, urologists may perform catheterization, prescribe medications that relax the prostate and bladder muscles, or arrange for minimally invasive procedures. In New York, specialized centers often provide same-day evaluations, allowing patients to access therapies such as transurethral resection of the prostate or laser treatments when conservative measures fail. For many men, seeking care early can prevent an emergency before it happens. Blood in the urine, or hematuria, is another alarming symptom that drives patients to urology clinics across the city. Sometimes the blood is visible to the naked eye, turning urine pink, red, or cola-colored. In other cases, it is microscopic and detected only during routine testing. Urologists stress that hematuria should never be ignored. While it may be caused by something as simple as a urinary tract infection or a kidney stone, it can also be the first warning sign of serious conditions such as bladder cancer, kidney cancer, or prostate cancer. In emergency settings, patients with heavy bleeding or clot retention, where clots block the bladder outlet, require immediate intervention. Catheters with continuous irrigation may be used to flush out clots, stabilize urine flow, and relieve discomfort. At the same time, diagnostic evaluations, including imaging studies and cystoscopy, are scheduled to pinpoint the cause. In a city where bladder cancer is not uncommon, prompt evaluation of hematuria can make the difference between catching a malignancy early or facing advanced disease. What sets urgent and emergent urology care in New York apart is both the availability of highly trained specialists and the constant demand placed upon them. With a dense, aging population and a fast-paced lifestyle, conditions like urinary retention, BPH, and hematuria appear frequently. Urology groups across the city work closely with hospitals and urgent care centers to ensure rapid diagnosis and treatment. Many clinics offer 24/7 access to urologists, understanding that delays can have lasting consequences. Whether it is a middle-aged man unable to pass urine at 2 a.m. or an elderly patient suddenly passing blood clots in the bathroom, New York's urology specialists are accustomed to responding quickly. For patients, the most important step is recognizing when symptoms warrant immediate attention. Inability to urinate, severe pain in the bladder, or lower abdomen, sudden blood in the urine, or worsening urinary difficulties should prompt an urgent visit to a doctor or emergency department. In a city where medical care is within reach, the challenge is not availability but awareness. Urologists emphasize that seeking help early prevents complications and, in many cases, saves lives. As New York continues to expand its network of specialized medical services, urgent urology care remains a vital safety net. Urinary retention, enlarged prostate and BPH, and hematuria are not just inconveniences. They are warning signals. Addressing them promptly ensures that patients move from crisis back to stability, with both immediate relief and long-term care plans to protect kidney and bladder health.